Hello, my name is David Eyre and I'm a Professor of Infectious Diseases, and I'm going to talk to you about what data there is in the Infections in Oxfordshire research database. So the database is a big collection of computer records from people going to the main hospitals and GPs in Oxfordshire, which is about 1% of all the people in England. And the database has information from two places. The first is from the Oxford University Hospitals NHS Foundation Trust and their electronic patient records. All of this information is collected together in a single place called a clinical data warehouse. And this NHS database contains information on a range of different things. So it has information on when people have stayed in hospital and what happened. So for example, did they have surgery or other procedures in hospital? Which parts of the hospital did they stay in? What kind of doctor looked after them? And what the doctor said was wrong. What was the diagnosis? It also has things like information on patients' temperatures and blood pressure, medicines they were given, including any antibiotics. It has information on outpatient clinics and visits to the emergency department. It has information on test results from blood tests and other tests, for example, tests where samples are sent to look for infection, like a swab. And these include tests that have been requested in hospital and also tests that have been sent from GP practices. The database has information on which GP practice people go to and which part of Oxfordshire they live in. It has information on just the first part of their postcode, so the first 3 or 4 letters and numbers before the space. And it has some basic information about people, their sex, their ethnicity, the month and year of their birth, but not exact details of when they were born. It also has information about patients who've passed away and when this happened. As well as this information from the patient records, additional information that's been collected on infections by researchers at the Oxford National Institute for Health Research Biomedical Research Centre are also included. And this includes detailed information, for example, about the DNA or genetic code of the bacteria and viruses causing infections that allows us to understand more about them. The Infections in Oxfordshire research database has information about a large number of people, more than 1 million, and it covers a really long period of time, over 25 years. Because there are so many people and such a long period of time involved, it's not possible to ask each person individually if it's okay to use their data for medical research. But the people who make rules about this kind of data have given permission for this. And this is known as ethical approval. And the reason for needing information on as many people as possible is to understand a number of different things. So we're interested in if people have passed away, that those particular people can tell us something about serious infections. And then where we're trying to track how infection spreads from person to person, having information on as many people as possible is important, because otherwise we may miss people in the sort of chain of how infection spreads. And you can read more about some of the different kinds of data that we have in some of the links provided here on the website.